More and more women are turning to alternative and complementary therapies for help with minor ailments and aches and pains of pregnancy. Dawn is visiting her acupuncturist, Andrew Flowers. He has been treating her throughout this pregnancy.
And emotionally, how are you doing?
It's been a lot better actually.
Right.
Been generally a lot happier and calmer.
Really?
Yes.
Very good. Do you want to have a like that? Put your shoes off. You can get different benefits from acupuncture at different stages in pregnancy. In the initial phases, it can help with morning sickness.
I had some acupuncture for the morning sickness. That seemed to turn off the real nausea. I was still being sick, but it just turned that really horrible, revolting feeling off. I had that through my pregnancy and this time round as well. This time I had it for... My asthma seemed to get quite bad this time. I don't know why. It didn't last time. But I had about 4 sessions of the acupuncture and I'm fine. I haven't had to use my inhaler at all, so because they were getting ready to put me on the steroid inhaler and Ventolin again, and I really didn't want to. And it's been brilliant for that, and heartburn as well.
The other side. Do you want a pillow between your knees?
Yes, please.
A little bit raised up here. I think it's good for things like fatigue as well, and when you're feeling really kind of run down. As the pregnancy progresses, there may be other problems that you might get. Those things can be alleviated with acupuncture. Digestive problems, for example, you might have problems with sleep, and it's good for calming the mind and helping to just help you to relax at quite a stressful time. In the 3rd trimester, things like, for example, if there's a breech baby or transverse presentation, a lower back pain, for example, or sciatic pain, some of the problems with the symphysis pubis, if you have problems with that, acupuncture can help to relieve those things. Finally, you can use acupuncture to help inductions.
I used acupuncture to try and induce the birth of my 3rd child. It was very relaxing and yes, made me feel all tingly, and it was lovely. But obviously for me, my baby did try to come out but couldn't for whatever reason, and lots of my clients go for acupuncture when they're overdue because they see it as a much more natural and more gentle way of trying to induce their labour.
So a little bit sharp and then a gentle ache. So I think on all those different phases there's quite a wide spectrum of things it can help with.
Catch the gas and air! It's coming, darling.
Whilst useful through all stages of pregnancy, acupuncture can also work in labour.
It's definitely useful, and the one that I would probably go with is using ear acupuncture with a small electrical stimulation of various points so that the woman can still move around. She's not kind of like restricted in her movements by having needles in her. She can move around, she can control the amount of stimulation that she gives. And there's good research to show that it can help to really reduce pain levels, basically, and improve the woman's ability to cope with things. Even acupressure, there's some basic points that a partner can use or a woman can use on herself that actually can really take the edge off some of the really more severe contractions. It's definitely worthwhile investigating.
But if complications occur during labour, Andrew knows that acupuncture and other therapies can only work for a finite period of time.
I think if it goes on for too long, basically your own natural endorphins become wiped out, and that's what acupuncture is working on in that situation. So if it goes on for too long, I think the acupuncture will stop working.
For Western societies, such complementary therapies are sometimes met with a certain amount of scepticism. But acupuncture and Chinese medicine has been practiced for thousands of years, much longer than our own Western medicine.
Chinese medicine sees giving birth as a obviously fairly exhaustive process, and in the West I think there's a tendency that they've done it and they get on with it and everything else, but I think they really need to be supported, particularly giving birth and then breastfeeding seems very tiring. They're saying 1 drop of milk is equivalent to 50 drops of blood. So a woman's really kind of depleting herself, and she needs to be nourished and supported in that process. And from Chinese point of view, postnatal depression is what we call heart-blood deficiency. So you need to nourish the blood to help kind of nourish and support the spirit.
In the clinic, Dawn is having the fine needles placed in her chi points. Dawn came to see Andrew during her last pregnancy and has found that his treatments have helped her in many ways.
You're reasonably comfortable?
Yes.
She was extremely fatigued at the beginning. She was very kind of tired, and I think acupuncture helped that. She had some problems sleeping, and that's again been settled. But also emotionally, she was quite emotionally labile, and she was getting very angry and very sad and very anxious, and she's actually calmed down quite a lot with that. She finds the acupuncture quite relaxing. Good. All right. I'll leave you in peace now. You have a good rest. Now we've got to wait and see if the presentation's okay, and see how she's after her first child. She was very depleted, and we gave her some herbs and some acupuncture just to kind of bring her energy levels back up to par, and she's been fine.
The use of herbs is a very important component of effective Chinese medicine, and Andrew Flowers uses this just as effectively in pregnancy and childbirth.
The herbs can help with morning sickness, things like fatigue, anemia during pregnancy. Chinese herbs can help with. They're very useful, for example, in preventing miscarriage. There's a lot of kind of a long tradition of treating women who are liable to having miscarriage with Chinese herbal medicine. I would personally tend to veer towards acupuncture, particularly in the first trimester, just because it's minimum kind of any intervention at that stage I think is advisable, particularly after birth, in terms of giving herbs to really nourish the energy and the blood of the woman is very important. If you do take them, you have to make sure that you go and see someone who's qualified, who you can speak to, who's up to date with some of the latest kind of research stuff, and who's got some experience of treating women who are pregnant.
For those struggling even to make a baby, acupuncture can prove to be very useful.
Often there's a kind of, it takes two to tango, and the woman might have some menstrual problems or history of endometriosis or whatever, and the man might have a slightly compromised sperm count, in which case then definitely advantageous to treat both of them. There's a quite an interesting study where they found that having acupuncture on the same day as you had IVF had a significant, I think it was about 40% increased chance of actually the IVF being successful.
Dawn's treatment appears to have worked very well.
Look, this is quite interesting. The redness around the needles, which is always a good sign in acupuncture. It's a sign that the qi has come to the area, and it's good. That you really reacted quite strongly.
Dawn will continue to see Andrew until well after her baby is born.
Thank you.
All right.